Dr. Stephanie here, and if you have knee pain can be caused by a variety of different reasons. There's a lot of injuries, maybe you fell on your knee, maybe you have IT band syndrome, kind of pain on the side of your knee, maybe you have a meniscus tear, or maybe you have some tendinopathy, or maybe you have arthritis. Arthritis is a very common disorder, and basically what arthritis is, there's osteoarthritis and rheumatoid arthritis. Rheumatoid is more systemic, so it affects the whole body. Osteoarthritis affects usually just one joint, although you can have it in more than one joint. And osteoarthritis is just the wearing away of the cartilage in your knee joint. And it can happen from past injuries. Sometimes people are just more prone to get osteoarthritis because of a family history. Sometimes it's because of being overweight or just repetitive activities. So it really depends, and some people get arthritis and some people don't. Most people at a certain age have a little bit of arthritis, but not everyone's is super severe, not everyone's requires a knee replacement, and if you have arthritis, that doesn't mean that you're necessarily going to have a knee replacement. And there's lots of exercises and things you can do to prevent a knee replacement or to, hold it off for a certain amount of time. Building up strength in your quad muscle and your hip muscles, that can help reduce stress on the knee joint and reduce pain in your knee so that you can do the things you want to do. So we're going to go through 5 exercises today that you can do if you have arthritis or if you just have knee pain. And these will really work on building up this strength so we really take that stress off of the knee. So let's start. We're going to do one on the floor. And you can do this on the floor on a mat. You can do this on a bed. You just grab a loop resistance band and place it around your thighs, kind of right above your knees, and lie on your back. And what you want to do is keep your feet about shoulder width apart on the floor, knees about shoulder width apart, and so you want a little bit of resistance in that band, and what you're going to do is a bridge. So just lift your hips up off the ground, and then bring them back down. So lift them up till your body's kind of in line here, and then come back down. Lift up and back down. This is a great exercise for building your glute strength and your quad strength and your core strength. So building all of that strength will really reduce that stress on the knee joint. So you want to do about 2 to 3 sets of 10 of those. And if the band is difficult at first, you can do it without the band and then add the band when you're ready. And then the next 4 exercises we're going to do standing. Because it's really important that we do weight-bearing exercises because most of the time if you have knee pain, it hurts more when you're walking around or walking upstairs or squatting down or doing things like that and not when you're lying down in bed. So for the next exercise, we're going to do a squat, and you may have heard, don't do squats if your knees hurt. That's not true, and there's also different ways of doing squats. So squats are a great exercise. They help build glute strength, they help build quad strength, they help reduce knee pain. But you may not be able to squat all the way down at first, and that's okay, you don't have to. We're going to do what's called a mini squat. So let me show you from the side first. So feet are going to be shoulder width apart, maybe a little bit wider, and you're going to kind of stick your butt back. Sit down like you're sitting in a chair. You can even put a chair behind you or a stool behind you if you want to, and then come back up. And this can be the smallest bend in your knees possible at first. So maybe you're like, I can't squat. Well, everyone can squat, and everyone should squat. Maybe you don't need to be squatting all the way down to the floor, but you can do a mini squat. And this really helps build strength in those quads and those glutes. So kind of stick your butt back, sit down just slightly, and come back up. Sit down, and come back up. And if you feel like, oh, that gets easy, squat down a little lower. You can also place a chair behind you and squat to the chair. So all day long, we sit down and stand up. So everyone has to be able to squat. You have to squat to sit down in that chair. So do these mini squats to start building up that strength, to start building your tolerance to squats as well. So you can do 2 to 3 sets of 10, just squatting like this. And go as low as you're comfortable going. Just kind of stick that butt back. just like that. So 2 to 3 sets of 10. And then the next exercise, we're gonna go ahead and grab our band again, place it around your ankles. And right there, I don't have anything to hold on to, but if you need to hold on to something, do this next to a counter or a wall or a chair. But basically what you're going to do is you're going to just tap your foot to the side and bring it back, tap the other foot and bring it back. Tap and together, tap and together, tap and together. So we're working, when we pull this leg out to the side, we're working our hip abductors, our glutes here. And then we're also working this leg because we're standing on this leg. We're supporting our weight with this leg. So this is kind of a 2-for-1 exercise. So we're just tapping out to the side. And you can do about 10 to each side, relax, and then you can do another set or 2 if you want to. Okay, let's take that off. And for the next exercise, we're going to bring this block here. And if you don't have a yoga block, you can use a water bottle or some books or whatever you have. Again, you can hold on to something if you need to. And then you're just going to tap over and tap back. So tap over and back. So again, we're using our hip flexors here. We're using our glutes. And then we're also stabilizing with this hip. So we're using both legs. So you want to do 2 or 3 sets of 10. And then you can move the block to the other side and tap over on the other side. You can also, if you want to, put a block on each side and do 1 tap, and then do a tap with the other leg if you want to. So 2 to 3 sets of 10 on each side. And then we have one more exercise. So for the last exercise, we're going to do a calf raise where we come up on our toes, and then a toe raise where we rock back and pull our toes off the ground. So we're just going to go back and forth. So up on our toes, and then back on our heels, up and back. And again, you can hold on to something if you need to. But it's important that we build calf strength as well, because the knee joint is surrounded by the hip joint and the ankle joint. And so all of the muscles of our leg have to be strong. So when we're doing this, we're strengthening our calves. And then when we rock back and bring our toes up, we're strengthening the front of our lower leg. So it's important we get everything. So you want to do about 2 to 3 sets of 10 of these. Just toes up and then heels up, toes up and then heels up. So all of these exercises will work on strengthening your quads, your hips, your calves, the front of your lower leg, and all building strength in those muscles takes stress off of the knee joint, which reduces pain and allows you to do more things without pain. So try these exercises. I would recommend maybe doing them 3 to 4 times a week and really working on building that strength so you can get rid of your pain.